In this video, we will present the 2022 through 2027 Illinois Comprehensive Cancer Control Plan Screening and Early Detection section. This is the IDPH vision and mission statement. The 2022 through 2027 Illinois Comprehensive Cancer Control Plan is available to view and download on the IDPH website at the link shown here. In this presentation, we will review the screening and early detection goals, objectives, and strategies. The screening and early detection section is on pages 21 through 26 of the cancer plan. Screening and early detection is defined as screening for cancer in its earliest stage when treatment works best. The first screening and early detection goal is to increase cancer screening. The baseline data is from the data source listed in parentheses after the objective. The target is where we would like to see the measure in 2027. All the objectives focus different types of cancer screening. Objective 1 is to increase lung cancer screening among adults 50 to 80 years of age to 6.9% by 2027. Objective 2 is to increase colorectal screening among adults 45 to 75 to 73.4%. Objective 3 is to increase breast cancer screening among females 40 to 40 years and older to 80.4%. The first two objectives listed here focus on increasing prostate cancer screening among Hispanic males to 19% and Black non-Hispanic males to 32.3%. The final objective is to increase cervical cancer screening among females 21 to 65 years of age to 76%. The second screening and early detection goal is to reduce late-stage cancer diagnosis. All data for the second goal comes from State Cancer Profiles 2013 to 2017. The first objective focuses on reducing late-stage lung and bronchus cancer to 40.9%. Objective 2 focuses on reducing late-stage colorectal cancer to 21.7%. The third objective is focused on breast cancer. The fourth objective is to reduce late-stage prostate cancer diagnosis to 21.6%. The final objective is to reduce late-stage cervical cancer diagnosis to 3.4%. The third screening and early detection goal is to reduce the cancer mortality rate. All data is from the State Cancer Profiles 2014 to 2018. The first objective is to reduce the lung and bronchus mortality rate to 38.5. This is much higher than the Healthy People 2030 target of 25.1 per 100,000. The second objective is to reduce the colon and rectum mortality rate to 13.7. This is much higher than the Healthy People 2030 target of 8.9 per 100,000. The third objective is to reduce breast cancer mortality rate to 20.1 per 100,000, which is higher than the Healthy People 2030 target of 15.3 per 100,000. Objective 3 is to reduce the prostate cancer mortality rate to 19.0. The final objective is to reduce the cervical cancer mortality rate to 2.2. The strategies are divided into different focus areas of policy, health systems, environmental changes, and health equity. Each objective has a policy of health systems, environmental changes, and health equity strategies. Each objective has a listing of the 4 types of strategies. Here are some examples from the screening and early detection section. Everyone plays an important role in addressing screening and early detection concerns. Individuals can get the recommended cancer screening. Community organizations can host screening events for the public. Schools can provide education on cancer screening. Employers can provide benefit time for employees to get the necessary recommended screening. Healthcare professionals can encourage and recommend regular screenings. Insurance and policymakers can promote coverage and access to recommended screenings. If you have any questions, please feel free to contact the Illinois Comprehensive Cancer Control Program at dph.compcancer@illinois.gov.